Good morning, everybody. Welcome to this morning's press conference. My name is Leslie Ann Johnson. We do apologize. We had some technical glitches a few moments ago. Nevertheless, we're here with you and we're happy to be with you this morning. So we're talking health issues this morning, a lot of pertinent matters. We have with us the Honorable Minister for Health, the Honorable Nicholas Steele. He's closest to me. We also have Dr. Francis Martin, the Acting Permanent Secretary in the Ministry of Health. Well, we know some time ago it was announced that from July 15th, which is tomorrow, the airport will accept commercial flights from countries across the Caribbean region viewed as low risk. So we'll be talking about the protocols in that regard and also about the level of due diligence and, as I mentioned, other pertinent matters. Without any further ado, I'll introduce you to the Honorable Nicholas Steele.
Thank you, Leslie Ann, and good morning to all of our viewers and listeners out there. Yes, as has just been said, we did say that we would be opening to the region, green zone countries on the 15th, and other countries internationally from the 1st of August onwards. Right now, I wanted to give you an update with respect to the various protocols, procedures, and precautions that we've put in place. We believe in order to open, first and foremost, we have to increase our ability to test, identify, and isolate should there be a possible case. Contact tracers training was completed last week, and the contact tracers will be engaged formally this week. That is an additional approximately 70 or 75 contact tracers. Testing facilities. The Ministry of Health has on island right now over 15,000 rapid tests, which is at minimum 3 months supply of rapid tests for opening borders, because everyone passing through MBIA would be rapid tested, as well as the ability to continue at the levels or increased levels within our own communities for rapid testing. The PCR testing facility is being commissioned right now this week at the General Hospital, and I will be doing a final assessment, will receive a final assessment from them at the end of this week. But we still do have the ability to test at St. George's University as a backup. Both facilities are being equipped with a what is referred to as an automated extractor, which would increase their capacity to test upwards of 300 tests per day, PCR tests. Just to put that into perspective, over the entire period of us testing, we've done about 900 tests, PCR tests in total on island. So we would have the ability to do 300 per day on island as we proceed. With respect to the airport protocols, in essence, the area allocated or identified for testing, rapid testing and PCR testing of arriving passengers has been identified, and the airport is in the process of getting that up and ready. They will not have it fully operational for the 15th, but will have it fully operational, or I am promised that they will have it fully operational for the 1st of August. Basically, there are going to be 3 classifications of individuals visiting Grenada, as we have released, but I will explain it to you now just for additional clarity. There's a green zones. Green zones are any countries that have had 19 or less new cases per 100,000 citizens in the last 14 days. So it's divided, it's per 100,000, so that we can compare country to country regardless of the size of their population. So most of our CARICOM, most definitely all of our OECS and most of our CARICOM countries meet the green zone criteria, in that none of us have had 19 or more cases per 100,000 in the last 14 days. Yellow zone countries are countries that have had 20 to 60 new cases per 100,000 population in the last 14 days. That would include Canada, most of Europe except Portugal, and except certain Eastern European countries for our discussions here. And red zone countries are countries that have had 60 or more new cases per 100,000 population in the last 14 days. That would include United States, Russia, Portugal, and some Eastern European countries, as well as quite a lot of Latin America, South America countries right now. So that is our classification. We get the information. We are relying on information that is being provided by the European Center for Disease Control, and they update their specs, their stats, on a daily basis. And like them, we would be making evaluations every 14 days with respect to countries. But we do reserve the right to make changes at shorter time if a situation does merit that. Quarantine facilities as well. The Ministry of Health is working with the Ministry of Tourism to certify additional quarantine facilities. And those will be announced on all of our websites as we complete that process. Right now, I am not aware of any commercial flight schedule as yet. While we have said that from the 15th, our borders would be open to the region, to green zone countries, I'm not aware of any commercial flights. We do have a charter flight coming from Trinidad tomorrow. Actually, maybe two charter flights coming from Trinidad tomorrow. And I know that the Ministry of Civil Aviation and Airlift Committee have been negotiating the final details on one or two of the airlines that have expressed an interest to do routes between the OECS countries. So that is the update I have with respect to the opening protocols. Look forward to questions. In closing, I think what I want to mention as well, part of the most important part of us remaining safe is our behavior and our ability to maintain a new norm. While we as a ministry and as a government are putting all of these measures in place, I will be the first to say, as I've consistently said throughout this pandemic, no plan is perfect. We must always assume that we have missed something. We look at nations much greater than us, with much greater resources, and they have dropped the ball. So that is why we continue to implore our citizens to make sure that they maintain the certain protocols, wearing of masks, keeping social distancing, avoid not having large gatherings. If we follow those rules, we put an extra level of safety in our communities. We have had, and the PS, Dr. Martin will mention some of those issues. We've had attempts by individuals to enter the country without going through the normal channels. We have had attempts of individuals trying to enter the country without going through the normal channels. We have been able to find and stop them before they entered the country. But what if someone does get through? What if that someone did get through, and the unfortunate gatherings that we saw over the weekend, that such a person was there infected with the COVID-19? We would have a sudden increase in community spread for two reasons, two very important reasons. One would be because someone did not respect our borders and our controls, but two, more importantly, because we as a community didn't respect our own protocols of not having mass gatherings or wearing the mask and maintaining social distancing. If we continue with the activities that we witnessed over the weekend, we will be putting ourselves at risk, extreme risk. And should the unwanted or possible person coming in be present at one of those gatherings, we would put ourselves in a lot of trouble. So we need to, please, maintain the protocols. I know it has been difficult for most, if not all of us. The confinement. We are not a people who traditionally take confinement well. It came at a great cost to us all, and we must remember that cost and not throw caution to the wind and jeopardize it. And we will all be able to proceed with a certain level of moderation and due diligence, and not have COVID spread throughout our country. Thank you.
Thank you very much, Minister. A very, very serious warning. I do hope that we take this on board. Dr. Francis Martin, the Acting Permanent Secretary, I'll give you the opportunity to make a few words.
Thank you very much, Dacian, and of course to all of our citizens and visitors who are on our island at the moment. The Ministry of Health is in a position now where, as I had said before, we're facing our highest risk. During COVID and during the lockdown, it was a more controlled situation. We were able to work on keeping COVID at bay during all of our processes and our structures, and that had paid dividends for us. Now, as we are about to open our borders, the risk is highest because we have no doubt now that the onslaught of diseases that we've been seeing internationally is certainly going to get into our shores, and as a result of that, we have to manage this. We have put most of what we need to put in place. No plan is perfect, as ministers have said, but we have increased our ability to test, to trace, and to treat, and of course our quarantine measures. And so I believe that we are on the right path when it comes to this. However, the Ministry of Health is really concerned about the continued actions of persons and the preventative measures that should be taken to prevent COVID. I can very well understand persons' view that we've done a good job so far, and the risk or the temptation to let your guard down. You are tempted to let your guard down because we continue to do what we need to do. We have had very serious situations where I have had to get personally involved in escorting people outside of our jurisdiction who try to enter into our country outside the normal channel. And this is to say that if people are trying to circumvent our rules to get in, by persons not practicing the preventative measures, you put yourself at risk, you put our countries at risk, because those persons can still sneak in through those areas. So we really want people to continue to do this. The other issues of quarantine as well, we take that very seriously, and we are in the process of beginning the procedures for charging persons who have broken quarantine. And we take that quite seriously because it takes just one case to start things going in a negative and a southward direction. Every country that had to manage COVID and had the devastating effect that they saw, they all started with one case. So we don't want to get a situation where we are back to getting cases, and worse yet, cases that we are not able to control because of people's behavior. So while we accept the challenge to be greater, we expect persons to be equally responsible and give us the support that you've always done to keep our countries safe. As we enter the rainy season, I would also like to encourage you to take the preventative measures that must be taken to prevent other forms of other communicable diseases. The mosquito is around the corner, the rainy season is around the corner, so I really want to encourage people to start doing things to keep the mosquitoes down, and as a result, help us to avoid other forms of communicable disease as we go forward. With these few words, I await your questions from our audience.
Thank you very much, Dr. Martin. Colleagues, the floor is now open for questions. Good morning, colleagues. Anybody has any questions? Okay, all right. Linda, go right ahead, Linda.
Good morning.
Linda, good morning. We're hearing you. Go right ahead.
Yes, good morning to all. We are actually I would bring to the attention of the host that media are not hearing on the Zoom. I'm actually listening via the Facebook page, so I could know when. Yes, I am going ahead. Are you? I would bring to the attention of the host that media are not hearing.
Linda, maybe you need to turn
Are
down
you
some.
hearing me now?
Yes, we're hearing you, but you need to turn down what is causing the
I am
feedback.
not hearing you.
Turn down what is causing the feedback, Linda.
I have no idea what is causing feedback, but via the Zoom, we did not hear anything from what the minister was saying. I actually listened using the Facebook a medium to hear what was being said. So with that said, my question to the minister as well as to Dr. Martin, mention was made of persons attempting to enter the country by, I will use the word illegal, not through the proper channels, as the minister said. Can they explain or share more some details on that? Are these people from neighboring countries? Are these people on yacht? Who and these people and where they had to be escorted to? Because Dr. Martin mentioned that he had to personally get involved to escort persons outside of the country. Can they share some more, as well as provide us with the figures and the numbers of the persons who had to be escorted out? And I also want to know if there is any difference between the COVID test that is done in our region as to compare with the COVID test that is done in the US. I asked that from the background that sometime last week there was a situation out of Antigua where these US nationals was tested positive in Antigua, but was then tested negative in the US within a couple hours. These are my questions for now.
Thank you very much, Linda. That particular experience I spoke about was one of our it was one of our ports. It was a yacht who attempted to get in with some passengers on board that did not go through the normal procedures for us protecting our borders. And when the yacht approached, I was called, and we follow our normal protocol and have the Coast Guard escort the yacht outside of our waters. A day later, we were able to confirm that the yacht was outside of our jurisdiction and outside of our region. So it's experiences and examples of this nature. That yacht had passengers or travelers from, I think someone from the Middle East and another from Australia or something like that. But it's just to give an example of what we have to deal with on a daily basis. So although people are not hearing much of what's happening from a COVID standpoint, we're still very, very active in terms of what we're doing to protect our country and keep our country safe.
If I can just start to discuss with respect to the testing, and then Dr. Martin, as the medical doctor, can continue. There are different versions of testing, yes. We use PCR testing. Here, I believe that is what the individuals were tested with in Antigua. And yes, it is possible to be tested positive, and then afterwards, I'm not sure about hours later, but I do know days later, once you have cleared with the virus, that you would test negative with PCR. So I think what you need to get, Linda, is a little more detail on the Antigua situation as to whether they were tested actually hours before they boarded a flight and then tested immediately when they got to the U.S. To say that, or whether they were tested a couple of days before when they first arrived in Antigua, and then tested as soon as they arrived in the U.S. And the other things to confirm as a journalist is that I know it is extremely difficult right now to get PCR tests done in a timely manner in the United States. We are fortunate, I think, here in most, definitely in Grenada and in most of the OECS countries that have stepped up now, that we provide tests within the hour. In other words, that someone can be tested immediately here in Grenada. And I've just also said how much we have increased the capacity of testing here above that. So I think more details need to be found on that as to what tests and the actual interval between the tests.
Yes, as Minister alluded to, I will give a bit of explanation as to why something like that can happen. What we have noticed with COVID and infection from COVID is that when persons are in the recovery stage of COVID infection, as the body gets rid of the virus, subviral RNA particles can remain in someone's system, sometimes up to months later on. So it is quite possible that if perchance a test was done at the time when there was a subviral RNA particle, meaning a DNA strand or a DNA particle, DNA fragment, of the virus, that person may return a positive PCR. Days later, if a test was done and there were no RNA fragments in the body at the time, that test may return a negative test. So this is what we have seen with COVID infection worldwide, and it is because of the body shedding fragments of the virus, which would cause positive and negative tests, one after the other.
Linda, you have a follow-up question?
It has to do with the same with the testing. Yesterday I saw on a Facebook page that a private facility was advertising that they are now doing PCR tests. Can the minister or the permanent secretary tell us how much private institutions that are allowed to conduct PCR tests at a private facility? And the other question had to do with regard to the yachties. Can the minister share with us what is the correct protocol for yachties entering the jurisdiction of Grenada?
Okay, as far as the testing facilities is concerned, we are aware that there is one private facility that does PCR testing for COVID, and 2 private facilities that do rapid testing for PCR. Those facilities engaged the Ministry of Health. We provided feedback for them in terms of their protocols and the tests that they're using. The Ministry of Health used the guidelines given to us by CARPHA to determine whether or not those facilities and the testing protocols meet the standards set by CARPHA. The Ministry of Health was sufficiently satisfied that they were within those guidelines, and so we were aware that 2 facilities are doing rapid tests and 1 is doing PCR.
With respect to the protocols are very similar from a risk analysis in terms of green, yellow, red, based on a travel history in the last 14 days. But any vessel wanting to enter Grenada to date needs to get in touch with the Port Authority to be scheduled, to ask permission to enter Grenada, because our borders are still officially closed. And upon getting in touch with the Port Authority, they will be told what time they can enter, so that the Coast Guard can escort them appropriately to one of the 2 ports of clearance that are now open, and then to one of the 2 quarantine facilities that we have identified. So any yacht doing otherwise and does not, as in this instance I'm told, did not immediately proceed to a port of clearance, is breaching our protocols, rules, and regulations.
Anybody else with questions, colleagues? Somebody's asking on social media, Minister, how would there are concerns about the behavior of some of the large crowds. We know that it shouldn't be a gathering of more than 20, but yet we see differently. Any conversations with the Royal Grenada Police Force as to how we might be able to deal with a situation like this?
But the Royal Grenada Police Force is charged with enforcing the regulations. And the regulations right now prevent such behavior. So I would expect the Royal Grenada Police Force to exercise their duties. In the interim, as a member of government, I'm pleading to members of the population, and also as a Minister of Health, to discontinue those type of large gatherings and that type of throwing caution to the wind behavior, because it will put us in trouble. It will definitely put us in trouble. We will be going backwards. We are no different from any other country. I know that I feel and we all feel sometimes that God has blessed us as Grenadians, this country and our people. But it doesn't mean that we must take God's blessings for granted and throw caution to the wind. We're seeing every other country that throws that caution to the wind and has mass gatherings, etc., getting into trouble. Why do you think God would treat us any differently? He has blessed us, yes, but we are not to take his blessings for granted.
Thank you, Minister. Colleagues, Gerard? Go ahead, Gerard. Good morning. Go ahead.
Yes, good morning. A question for either the Minister or the Permanent Secretary. In terms of the categories, the three categories, would the persons especially coming from the yellow and red zones, would they be handled differently at the airport?
Yes, persons coming from red and yellow zones would be handled differently. All individuals entering, whether green, yellow, or red, will be rapid tested at the airport. So that's a small fingerprint prick. You get a drop of blood, and within 10 minutes we get the results back. So all individuals will be tested there. But individuals coming from yellow and red zone countries would also have to take a PCR test within 48 hours. It will either be done at the airport or within 48 hours of arrival in Grenada. During that 48 hours, both yellow and red zone individuals will be quarantined in state-certified quarantine facilities. After that test result is received, yellow zone country visitors are allowed what's referred to as limited movement, whereas red zone country individuals still remain quarantined for the entire period of that quarantine, which is the 14 days. So that is, yes, it is different. Plus, red and yellow zone individuals cannot leave the airport on their own. They must be escorted or brought by state-certified transportation to those facilities. A green zone person walks out of the airport and participates in life in general like the rest of us here.
You have another, Gerard?
Yes. We have seen what would have happened in St. Vincent recently. What is the Ministry of Health doing differently to prevent such a situation?
Well, first off, as I said, in the first 48 hours of yellow and red zone individuals being here, they will be under strict quarantine observance. We are also using implementing GPS wristbands, as well as applications on phones, cell phone applications. We do have facilities here for quarantining. So that puts us in a different situation to St. Vincent. And therefore, before an individual is allowed to go straight to if their house or home or an additional facility that they chose that was approved, before they're allowed to go there, they would have to await that PCR test result on arrival here. While we insist on everyone coming from yellow and red zones to do their PCR test before they board, they will still be PCR tested on arrival here. The reason for that, one, we believe that it is essential that somebody be PCR tested before they board an aircraft if they're coming from a zone that has large-scale community spread, because they need to know whether they are infectious and whether they are going to board an aircraft and infect other people, and we think the airlines have a responsibility to ensure that they don't allow individuals onto their aircraft who could be infectious. The PCR test on arrival here is because we are very much aware that you cannot get a PCR test immediately before boarding in those countries. And sometimes it would be days before travel. And therefore there is a possibility of interaction with individuals in the community that they're coming from. And there is a possibility of them being infected, even all the way up to the airport. So that is why on arrival here, individuals coming from medium and high risk countries would still be PCR tested.
Minister, I have two questions from social media. Someone wants to know how is the government treating the 2 days, Carnival Monday and Tuesday, if it would still be public holidays, and somebody else is asking what is meant exactly by limited movement.
With respect to the 2 days, as far as I'm aware, announcements were made that Carnival has been postponed or cancelled for this year. I know that the first Monday in August is Emancipation Day, and that is a holiday unassociated to Carnival. But I know that the second Monday in August is Carnival Monday. So I think that question can be implied. The answer to that question can be implied from my answer. As far as I'm aware, Carnival is not happening on the first Monday of August this year. The other part with respect to what is limited movement. Limited movement means that individuals who have been told that they are allowed limited movement, yellow zone countries, they can be transported or move around in taxis that have been trained and certified by Ministry of Health and Ministry of Tourism. They can go from one tourism site to another tourism site that has been certified by the Ministry of Tourism and the Ministry of Health. They can be allowed to home quarantine once we are able to ascertain that there are no individuals, high-risk individuals in their own home, i.e. someone who's elderly, someone who has any of the conditions that would put them at high risk. They can also move to various, from one home, they can move from their homes if they are allowed, but not to take public transportation. 1 and 2, they are not allowed to attend large gatherings, which would include weddings and funerals.
Do you have another, Jared, or can we move on to Linda? Jared?
No, I don't. Not for now.
All right, great. Linda, go right ahead.
Morning again. Minister, last week when the news release was issued of our reopening of the airport on the 15th, at the end of that release was a company name given to assist with charter flights and so. I think it's Caribbean Trade Inc. Can you tell us more about that, the role of that company? Who are the people behind that company? Secondly, with regard to the yachties, was it a case of only yachties who are trying to enter Grenada illegally, or we have persons from neighboring jurisdictions trying to come in using small boats and so? Like, for example, in the Grenadines, we're really close to Carriacou and St. Vincent Grenadines, they're very close. Is it that kind of illegal entry and had to be stopped? And finally, with regard to the restriction of movement, sometime before I saw that the use of an app to be downloaded on phone as well as a wristwatch is being considered or will be given. Will these people who would be in now be seen as having restricted movement, will they be followed using any of that type of technology?
Yes, well, Linda, the first part of your question, or the first question, which is the facilitator, as we can refer to it, and an entity approached us to say that because we have all of these protocols, procedures, and steps that must be taken before you could even book a ticket to come to Grenada, and then before you can board, and then when you get here, you may be quarantined, etc., and that it depends on where you come from. There was a company that approached the government to say, can they make private arrangements with individuals desirous of coming to Grenada to help facilitate all of this. Basically like a tour operator or a travel agent. And we said yes. So that entity is providing that type of service. They will assist, and especially between now and 1st of August, where we do not have any commercial flights coming from red or yellow zone countries. They will assist with if there's a charter available, or to mobilize enough individuals to organize a charter to make sure people get their test, to tell them where, because we are aware as well in some states it's very difficult, if not impossible, to get a PCR test in a timely manner unless you have been referred by a doctor because the doctor believes you have, and not simply because you want to travel. So they will facilitate in that. They will make sure that all of the required health declaration forms are filled out before the person boards or before the person travels. They will make sure that the appropriate quarantine facility here has been arranged with the individual, because remember, individuals must pay for their own quarantine. It is not at the expense of the state. So all of these things will be arranged by this facilitator, the same way that a tour group or travel agent would arrange those things. And the government has given permission to that. The government is not paying the individual. The individual gets no funds from the state. The individual just offers a service to people desirous of coming to Grenada, and if those people choose, they can engage that entity. What was the last part of your question, Linda?
I think it had to do with the persons trying to illegally enter.
Right.
Yeah. Well, during our whole COVID response, the issue of small boats coming in has always been something we managed in the past. Fortunately for us, we managed it well because we had good collaboration from the citizens of Pitimatlik and Carriacou. So that wasn't a big problem. The issue that we speak about here, though, it was a yacht, international yacht that came in. It was not anything to do with our sub-regional entry.
Yeah, and I think also with respect to inter-island traffic, not just good cooperation with the people of Carriacou and Pitimatnik, but also in terms of facilitating an access point to allow people from Union, because, for instance, when they had the terrible gas station fire, the only gas station in Union, but to allow a mechanism for individuals to come back and forth under a controlled environment, that allowed us to monitor that traffic. And our issue is that we want to be able to monitor all traffic, and that's why we say individuals must notify us, other individuals must notify us before entering our waters.
Linda, thank you, Minister and Dr. Martin. I see, Linda, you want to clarify something? Go right ahead.
Yeah, Minister, the company that we spoke about, you said the company approached government. Is there room for that? If another organization or company want to offer similar service, can they also approach government with their own proposal, or it is just locked with that single company?
No, it's not locked to that single company. They have approached government. They were told, well, more of a no objection from government, that yes, they can proceed. They have made the necessary arrangements to have clear and interaction with the Ministry of Health and the various other government entities. And if there's someone else that wants to offer that, we would be open to that as well.
Colleagues, anybody else, or are we through? You have 10 seconds. Seems as though they've exhausted their questions. So, Minister and Dr. Martin, I'll give you the opportunity to make a few parting words.
In closing, I'll be happy for our country folks to keep supporting us as we've always done during the COVID. If you continue to do the preventative measures, as I've said from the beginning of our COVID experience, if you follow the advice that we're giving to you, we are expected to reap good dividends. So keep trusting what we say to you from a ministry standpoint. Keep protecting yourselves. Continue to eat good, bright-colored foods, especially now that the borders are open. It is even more important now to eat bright-colored foods and drink lots of water. Rest a lot, protect and improve your immune system, because the worst is yet to come, if you want to put it that way. So let's all be careful.
Yes, and in closing, just simply to add to that, yes, we have won most of the battles that we went through so far with COVID, but the war is not over. There are more people infected now daily with COVID-19 than ever before. And those numbers keep increasing. So let me repeat that to put things into perspective for those who think they can throw caution to the wind. There are more people infected now daily worldwide than ever before, and the numbers keep increasing. The possibility of one of them slipping through the nets that we have put does exist. Should that happen, and we are all following protocols here, the risk is limited, minimal. But should that happen and we're not following protocols and we're having street parties on the beach, the risk is significantly increased. And I think as individuals, we need to be responsible and not just simply rely on the Ministry of Health and the government to save you when you get into trouble.
Thank you very much, Honorable Minister Nicholas Steele, Minister for Health, and Dr. Francis Martin, the Acting Permanent Secretary in the Ministry of Health. Well, I think you've heard it all. We need to be as cautious as possible, especially since from tomorrow, July 15, the airport will accept commercial flights from countries across the Caribbean region. Although deemed as low risk, it was pointed out that there are some people trying to circumvent the situation, and we need to be as cautious as possible. Thank you so much for being with us. I am Leslie Ann Johnson. Have a great day, everybody.